Well, as Atlanta prepares to welcome hundreds of thousands of visitors here to the city for the FIFA World Cup just days away, doctors, meanwhile, closely watching for what big global gatherings can mean for infectious disease spread. Joining us now is Dr. Jodie Guest, the Senior Vice Chair at Emory's Department of Epidemiology, a friend of the show. And Dr. Guest, it is always great having you here. Thank you for your time.
Thank you. Thanks for having me back today.
Oh, you're very welcome. We're 6 days out. Important topic here from the first match here in Atlanta for the World Cup. What are you going to be watching from a public health perspective?
We're most concerned about respiratory spread, illnesses, and heat related exposures during the FIFA Cup. So those are really top of mind.
I guess heat kind of goes without saying. The heat and humidity are hitting here, and some of the visitors may not be used to it. Is that what it comes down to?
Absolutely. We're already seeing a rise in heat related visits to emergency departments around the state of Georgia, and it's only June. We know that we get a lot worse heat as the summer goes on.
All right, and you mentioned respiratory spread. Specifically, what viruses are you concerned about?
We are concerned and tracking for cases of flu and COVID, and also, unfortunately, measles. Measles is at an all time high for the last 20 years across the world, and it's really growing in all regions of the world. And so, when we have a mass mixing event like FIFA, we are going to have cases from all over.
Yeah, can you talk about how easily measles could spread in a crowd setting, and what's the incubation period like? How does that complicate things?
Yeah, measles is incredibly transmittable if you are unvaccinated. So we know that there's over a 90% chance that someone who is unvaccinated and has been in a room with someone who has an active measles case within the last 2 hours, you have a 90% chance of contracting measles. That is a very, very high transmission rate. And we know that we have higher number of cases than we've had in many, many years going on due to decreasing rates of vaccination. So it's really top of mind. Also, just our traditional colds and flu. Other parts of the world have flu activity now at rates that are higher than the US. And if they're traveling to the US, they may bring that with them.
Yeah, because when I think flu, I think winter virus, right? But then you're reminded
Exactly.
the southern hemisphere, they're dealing with winter right now. So I guess, are they dealing with the flu? A lot of the countries that are coming here for the World Cup?
They sure are. So we don't have a lot of activity that is endemic at this time of year, as you pointed out, in the United States. But the Southern Hemisphere is having their winter season, and that's when they see the flu.
Okay, here in Fulton County, the Board of Health, they said they have a plan should there be a measles outbreak, going to one of your larger concerns. What would an outbreak look like in Atlanta for the summer?
It would be tracking, and we would want to see and know where the cases are as quickly as possible. And then you have to do really shoe leather epidemiology, is what we like to call it, where you are talking about where this person has been by the hour, and then everyone who is around them at that time. And with a mass mixing event, again, like FIFA, where people are coming from all across the world, all across the United States, you are then going to be contacting all those other areas to say this person was potentially at risk, and you need to notify them, and you pass that tracking on to that health department or that country's health tracking system.
Can health departments study the wastewater at some of these stadiums where the games are held?
Wastewater is an incredibly important tool that we now have. What it does not show us is who has an illness, but it does show us if it's higher than normal activity. And so that is a warning sign for us to know that something is going on. But again, it does not help us know who that person is.
Okay. What about the Ebola risk? As of this morning, Congo has 550 cases, 100 deaths. Obviously, the country's team playing here in Atlanta. So, is there any risk of Ebola making it to the U.S. during the games?
The risk for the United States and people coming into FIFA for the World Cup is still extremely low. The outbreak, which is a very, very large outbreak, is still very centered in the DRC and Uganda. The DRC team has been playing and training in Belgium. So they have been out of the DRC for the entire period of time that we would be concerned about their risk to bring it. And they're, of course, being very, very heavily monitored. They're working in kind of what we would call a bubble at this point in time. So we do think that the risk is very low, but this is a tragic outbreak. And we also need to be very concerned about the people that it is affecting.
I mean, do you see it get any worse at this point, the outbreak down there?
Absolutely. The numbers that you quoted are confirmed cases. Because of a lack of support for contact tracing, not enough people on the ground doing this work, we have an expectation that there are thousands of more cases out there and
Mm.
probably hundreds more deaths that we are not knowing about at this time.
It's hard to read about some of the stories coming out of there to the Congo. Back here in Georgia, meanwhile, do you have any final advice for Georgians as we head into the World Cup, whether they're going to the games or not, when it comes to staying safe and healthy?
If you're going to the games, you certainly want to be hydrated. So to talk about our heat risk, which again, most Georgians are used to, but you're outside for a long period of time for those games. You want to make sure you're careful in crowd control as well. We can expect additional injuries more than we would normally see during big events like this. And if you're not feeling well, or if you're not up to date on your vaccines, you may want to think about if you should be attending or not. These events are outdoors largely, and so that is good news. That helps decrease some spread, but these are large numbers of people who are together. And if you get sick after being at an event, particularly if you're unvaccinated for measles and you end up with any measles-like symptoms, you do want to contact your health department immediately.
Okay. Dr. Jodie Guest, voice of common reason on this show. We always appreciate your expertise and analysis. I feel much better talking with you every time. Senior Vice Chair at Emory's Department of Epidemiology. Thank you again.
Thank you so much, Dan.